Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. We're taking your calls at 866-870-5752 right here in the studio. What do you think, Dr. Darrow? Would you like to take a call?
Yeah, Aurora, Dr. Marc Darrow, hang with me for a second. This is the second half hour of our show, Living Pain-Free. And I just want to give the people listening in their cars and at home a little heads up. There is a book that I wrote called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. I'm going to send it to you free, Aurora. It's a $25 book just for calling in. It has a foreword by the beautiful Suzanne Summers, who is a great advocate of what's called alternative medicine, but has really been the medicine that's been on the planet since the beginning of time. And she also wrote a chapter about me in a book called A New Way to Age, which is a giant book of hers. It's page 302. It's about 15 pages long, and it talks about her journey in regenerative medicine. I've worked on her. I've worked on her son Bruce and other members of the family and Bruce's kids. And it's kind of a great story. Bruce used to live next door to me back in Santa Monica years and years and years ago when I first started doing regenerative medicine when I was a resident at UCLA. And Bruce loves bicycle riding on the street. And Bruce doesn't love getting hit by cars and falling off, but that would happen. So he was getting injected on my table in my living room many times. So he did very well. I don't think he rides bikes anymore. I think the family kind of stopped him from doing that. But these techniques of injections are very simple, very easy. We draw your blood, or we can draw your bone marrow, which takes me 15 seconds, believe it or not. It's like a blood draw. And we can get your stem cells and platelets and inject them in the area where there's a problem, arthritis, anywhere, really from the top of the head to the bottom of the feet and everything in between, to help regrow cartilage, tendons, ligaments, all these things that are the pain generators in your body. I like to get MRIs and X-rays, but I don't use them to diagnose or to figure out where to inject. I use my hands. I'm old school, like my grandfather, who was born in the 1800s. Back in his day, they didn't have anything like that, so he used his hands to diagnose. Gee, that's amazing. Why don't doctors do it today? I don't know. Don't they want to spend the time? I don't know. Most people that come to me after failed surgery, the doctor never ever touched their body. That makes no sense. They operated on an MRI. Does that make sense to you? Not to me.
No.
Anyway, Aurora, God bless you for calling in. Thank you so much. Your hip bothers you, or both hips?
Oh, okay. And then I'll get more once I read it. I don't know if you do consultations or I can.
Yeah, we could do a consultation. I'm going to write this down. The phone number to my office is 800-300-9300. 800-300-9300.
I have it.
Good. So yeah, you can come in. If you email me by going to the website, www.lastemcells.com, www.lastemcells.com. There is a spot on every page where you can email me, and I'll set up the appointment for whatever time you like, or you can just call the office and do it. Love to see you. We'll figure out what's going on with your hip.
Okay. Thank you very much.
God bless you, Aurora. I appreciate your call. So, Julie, Dr. Marc Darrow, you have a meniscus injury or
Hi,
issue.
Dr. Darrow.
Tell me about it. How long has it been there?
Well, I've had problems with his knee off and on over the years. I've got a small bone spur on the outside of my right knee.
Okay.
And then I think I've got I don't remember what all the issues are, but I do have a small meniscus tear on the inside of the right knee.
Yep.
Meniscus is something that you treat, right?
All day long. More of those really than anything else.
Yeah, I think I used to do salsa dancing, and I think it did a number on my knee.
That salsa was kind of spicy, huh?
Yeah. I don't do salsa dancing anymore. Unfortunately, I think that's what happened. So, and I also have a hip issue.
Okay.
That I did get 2 injections for about 3 years ago. It had minimal effect.
Okay.
But I still have the hip pain.
Okay.
So, I was mainly calling today to find out about the meniscus, if you have pretty good results with that.
Yes, excellent results. I'm not giving you any guarantees of anything if you come in, because I don't know how you're going to do. I've had people heal and then they fall down and then blame me because they hurt again. So I always have people sign something saying, no guarantees, and please leave it alone after I inject it so it has a chance to grow the tissue and heal. So what did your doc say about your hip? Did they do an x-ray, MRI, or anything?
They did. Yeah, I have an MRI on that. I've got some kind of tear in there. I don't
in the
remember
labrum.
what
It's called the labrum, most likely. And I don't find that labral tears cause pain. I have a lot of people that we inadvertently find labral tears and they don't have pain. So don't get caught up in getting a surgery for something that can make you worse.
No, I'm not even. It's not even at that point. It's minimal pain. I mean, it's just kind of chronic low-grade pain that I feel. But there's been no talk of hip surgery.
Well, same thing with the knee. Just because you have a meniscal tear or you have a bone spur, that doesn't mean you have pain. And because you have pain, doesn't mean it's causing from those.
Doesn't mean it's what?
Because you have pain does not mean it's coming from what the doctor told you the problem is.
Exactly, and the doctor is not recommending surgery at this point. I have had an injection of cortisone, just one. I didn't, of course, I know cortisone isn't the best.
What do you think cortisone does to the cartilage?
Oh, gosh, it probably probably ruins it, right?
Kind of. I would look that up on Google right now. Put in cortisone and then put in cartilage, those 2 words. And you find out for yourself. You'll read the studies on it.
Yeah, well, fortunately, I just did it the one time. And then he said if that doesn't work, even though he's a surgeon, I think he's fairly conservative. He said we would do physical therapy.
Good.
Do you think physical therapy is helpful for meniscus tears?
No, but you can do it.
No?
It's not going to fix a meniscal tear. And I've been to physical therapy because so many of my patients go, and I wanted to find out what it was like. I didn't have a whole lot happen there. It's stuff I can do myself. But that's not saying it's not a great thing for certain people. I mean, if you're older and you don't know how to move, they can help you learn how to move. If you're falling down, they can teach you how to fall without breaking a hip. It's called ambulation or gait training with fall recovery. You don't want to fall down in the kitchen and you can't reach the phone and die out of starvation. That happens. But for the most part, the work that I do is all based upon regrowing tissue and healing the area. And that's what I think, and I'm biased. I'm not going to lie to anybody. I'm very biased. I've been doing it on my body for over, how many years? Since like 97. And I've had great results every single time I've used it. So, I see great...
Would you say there's an average number? You probably will say no, but is there an average number of treatments?
No, I don't know what average means in the whole world, unless you have 10 million numbers and you average them up. And it's still different. It's still different than averages because humans are strange beings, and they do things that they know they shouldn't do. So they don't follow orders very well. And they're just going to do it one time and sneak by and then think it's okay. So no, there's no averages. Some people get better with one treatment. Some people never get better because they don't follow my advice. And then some people who are doing this with other doctors are doing it with doctors who have no idea what they're doing, or having nurses do the injections without ultrasound. You need that ultrasound to get into the joint if it's a joint issue, because the ultrasound can guide the needle. You can actually watch where that needle is going. And then there's other things that are, reasons why it doesn't always work. But for the most part, it works if you stay with it.
Yeah. Well, good. I have a medical or insurance question. Does Medicare cover any of?
I don't get into insurance questions on the radio because it's really confusing. But you can call the office at 800-300-9300. 800-300-9300. The people by the phones usually, and you can ask them all the questions about that. It's very complex. Insurance is so complex today that I don't know anything about it.
Right.
Most of these procedures are not covered by regular health insurance, but if you're, workers' compensation, or you're in a car accident, something like that, or if you have a health savings account, then it's paid for. So it's too complex to get into now.
Right. Sorry, that office number was 800-300-9300?
Perfecto. You got it.
Got it. Okay.
And another thing is, you can just email me right now. Go to the website, www.lastemcells.com, lastemcells.com. Every page is a spot to email me. I answer emails all day long, usually till about midnight or later, and between patients. And I love communication. That's my thing. People always say, why do you spend so much time communicating with me? And I go, because I like it. My patients are my social life. I'm an introvert. I don't like going out. And so I like talking to people. I like talking to people one-to-one. And if you were to text me, I give people my cell number. If you were to text me, I get back in like 5 seconds. And the people are like, oh my God, no one does that. I do it.
Right. One last question. If I'm having just minimal pain, but the pain is there, and I'm the only exercise I can really do, I used to run, but of course I don't do that anymore, is hiking, and not hardcore hiking, but just hiking or walking uphill, and just general walking. Is that going to aggravate the meniscus?
You know what? I always tell people to do whatever they want if it doesn't hurt too bad, until they get a treatment, and then I want them to chill for a while. Right.
After the treatment, do you have them rested for what, like a week or something?
Yeah, it depends. Depends what's up, but yeah, it could be a week or so. It doesn't mean laying in bed. You can walk around, just don't go hiking, don't go to Costco and be on your feet for 3 hours.
No golfing?
No, I don't golf.
I'm busted.
All right, well, listen, I'll let you guys go, but thank you for your time. And you do consult appointments, right?
Of course. And if you email me, I'll consult you, over the email and maybe call you.
Great.
But I actually, like I always tell people, I'll give you information, if you're not in the office, but I'm not going to tell you any results because, or the odds, until I actually examine you. I've got to touch everything and see what is going on. There are way too many people who come in, for example, ready for a back surgery for something like spinal stenosis. Okay? Spinal stenosis doesn't really cause back pain. And they're going to get a surgery for that. And I examine it, and it's nothing more than a sprained ligament in the back, iliolumbar ligament, interspinous ligament, something we can fix real easy. And they're ready to get a frickin' surgery.
Oh, gosh, I know.
And then sometimes they'll have pain down a leg and say the doctor needs to operate on their back because of that. and the doctor never touched their leg. It's not a back problem, it's a leg problem.
Exactly. Yeah. No. Yeah.
You know, the greatest tool a doctor has is the history and the physical. History is finding out what happened and then touching the body to find out where the pain is being generated from. And the art of history and physical is gone today. People are in too much of a hurry.
Yeah, I've been going to my chiropractor just for the last week.
Yes.
To get ultrasound on the meniscus and the knee, and it seems like it's helped a little bit.
Well, that's good. I mean, always do the most conservative thing you can. Getting ultrasound treatment is easy. It's cheap. You know,
right.
Do it if it works for you. Always do what works for you.
Yeah, what was interesting is when he was pressing the ultrasound wand on my knee and the front of my knee and, of course, the inside meniscus area, I didn't realize how tender it was and how much discomfort there was until he was pressing on it. So,
well, that's a good thing because that means you're walking around in bliss. Ignorant bliss.
Oh, no, it's not bliss. But it's tolerable pain at this point. It's like a 2 or a 3.
Well, one of my greatest referral sources are chiropractors.
I'm sorry, you broke up there. What did you say about your chiropractor?
One of my greatest referral sources are chiropractors.
Yeah.
They send me their dead-end patients, the ones that they think that they can't fix because they worked on them for a while, and they think I can. I love chiropractors. It's very funny because I have a mentor who's the guy that said, Mark, you're going to be a doctor. And I said, I am? I said, I don't want to go through 10 years of study. I said, how about if I'm a chiropractor? And he said, you will be a chiropractor with an MD license. So get to work and get into medical school.
So your MD is in what?
My MD just means medical doctor. Every MD is the same MD. It means 4 years of medical school.
Right.
After that, we do an internship. Yeah, well, my residency, my specialty is called physical medicine and rehabilitation. It's non-surgical orthopedics.
Yeah. One last question real quick, back to my shot of cortisone that I got.
Yeah.
On a percentage scale, I don't know that you'll even give that to me, but how much do you think I damaged my knee by getting that one cortisone shot?
Darling, when you're in heaven, you won't care, so don't worry about it.
I know.
You know, that's the question of how many angels dance on the head of a pin. Nobody knows.
Exactly.
For some people, it's disastrous. Other people seem to get away with it. But then down the road, they end up with arthritis. I don't know how to answer that question. Look it up. Be your own doctor. Yeah. Go to Google. Put in cortisone and cartilage. See what they say. Because they do studies.
Okay, Dr. Darrow. Well, hopefully maybe when school's out, I'm a teacher. I'll get over there
wonderful.
And get it.
I take care of so many teachers, you would not believe it. I don't know what they do to you guys, but maybe being on your feet all day long.
Well, we have to do lots of bending and squatting with the little ones, you know.
Right. Oh, you have little ones. That's so cute.
That doesn't help my knees, I don't think.
What grade do you teach?
I'm a substitute teacher, so I do grades K through 12.
Okay, good. Well, I love those little people. I love them a lot. I've got 5 of them, and then they're having kids too.
They're cute, but they're a lot of work. I actually prefer the older kids.
Yeah, but then you get into the hormone changes when they're older too. So either way, it's work. It's work.
Yep. You never know.
And you know what I always tell people? I have 5 children, and people say, how old are they? And I go, it doesn't matter. They're always your child.
That's right. Amen. That's very true.
Well, God bless you, Julie. We appreciate your call. I'm going to give out the phone number to the studio right now. And the number here to talk to me and Nita is 866-870-5752. We're talking about PRP, platelet-rich plasma, which is taken from your blood, and stem cells, which we can get from the bone marrow, and platelets from the bone marrow. Whether we draw blood or we take your bone marrow, it really doesn't take much time. drawing the bone marrow is really like taking blood. It takes me literally about 15 seconds once I numb up the area. It's pretty cool. I've done mega thousands of them. People come in and go, "Oh, I heard bone marrow is so painful." Not the way I do it, it's not. When I went to learn about it at UCLA, I watched a hematologist draw out 60 cc's of bone marrow in about half a second, and the patient screamed. And I said, "What did that feel like?" And he was a guy from Bakersfield. He was a cowboy. And he said, "It felt like a mule just kicked me in the butt." So what I do is not like that at all. The very small amount of bone marrow we use to get the stem cells and platelets, and it's done very slowly. So when I say slowly, I'm talking about 5-10 seconds. So people don't usually have any kind of issue with that procedure. So, Nita, let me go to a joke.
Okay, free book, phone number.
Free book. Call me up right now. You get a free book called Stem Cell and Platelet Therapy. Regenerate, Don't Operate. It's a $25 book. It's got about 250 studies about stem cells and platelets and how the surgeries really are not the way to go anymore. Not that they ever were. But it's still the culture of medicine, musculoskeletal medicine. It's still a culture of surgery and medication. And hopefully that's changing. It is changing because I get busier every year. And believe it or not, orthopedic surgeons are now referring their patients to me. So I know this is starting to change. Medicine is very slow in having things happen, but it is changing. Do I have time for a joke here?
Well, sure.
Okay, you'll never get this one. I like it.
I'm sure.
Why do you tell actors to break a leg?
So they have something funny to think about and do a great performance.
Well, that's the truth, but it's not the answer to the question.
I'm sure.
So why do you tell actors to break a leg? Because every play has a cast.
Oh, I never would have thought of that. That's incredible. That's incredible.
Finally got you to laugh, Nita. Took me a long time.
God.
You're not giving out the laughs easy today.
That is very
I'm going to give you
funny.
one last chance before the end of the show. What kind of dogs love car racing? Lap dogs.
Oh. Because they can sit on your lap.
I hope you're writing this down.
No, I don't need to write it down. I'll remember.
So you can tell your patients about it.
Well,
cheer them up.
That could work. Yeah. Yeah. A little laughter during break up the tension of the session.
Laughter's the best medicine.
It is.
It's the very best medicine. You know why? It gets your mind off the issues that we all create over nothing, and it releases endorphins. I have my patients laughing all day long. You know who taught me that?
J.R.?
Norman.
Oh, Norman.
No.
Norman.
Yeah, well, John Roger did also. Yes, John Roger was big on laughing. John Roger is my spiritual teacher. He's my minister, my pastor, you might say. Norman Cousins. I'm going to give out the phone number one more time to the office, 800-300-9300. My website is www.lastemcells.com. You can email me from every page on the website. I love everybody. Thank you, Nita, Suzette, Alex, and the crew. God bless you all. Thank you, Nita Valens. You're a great host.
Thank you, and we'll see you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, To take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.
Thank you.